All right, guys, so today we're going to talk about blood sugar testing. Why do we do it? How do we do it? And why is it so important? I want you guys to remember that diabetes is a blood sugar disease. If we don't know our blood sugar, how are we going to properly treat our disease? You must do it if you want to control your blood sugars. So, next question, how many times should we test our blood sugar? At my clinic, we ask patients to test their blood sugar 4 times a day, and we call it the 4 befores, meaning before breakfast, before lunch, before dinner, and before bed. Your fasting blood sugar is so important because it tells us how your basal or your long-acting insulin is working. The basal insulin is supposed to keep your blood sugars flat when there's no exercise, food, or rapid-acting insulin involved. Therefore, your fasting number is the most telling about how your basal insulin is working. For instance, if you go to bed with a blood sugar of 120 and you wake up with a blood sugar of 200, that tells us that your basal insulin is too low. If you go to bed with a blood sugar of 150 and wake up in the middle of the night with a blood sugar of 60, we know that your basal insulin is too strong and we need to decrease it. So that's why we ask you to test your fasting numbers. We ask you to test before lunch because that will give us a good idea about how the insulin you gave for breakfast worked for you. We ask you to test before dinner because that will tell us how the insulin you gave for lunch worked for you. And we ask you to test before bed because that will tell us both how the insulin you gave for dinner worked for you and will give us a good baseline to evaluate your basal insulin the next morning, as I talked about earlier in this video. So let's go over how to check your blood sugar. In this video, I'm using the Contour Next link, but these instructions can apply to pretty much every glucometer. So the first thing I'm going to do is open up my test strips and insert one of my test strips into my glucometer. See? Next thing I'll do is clean off one of my fingers, cock back the lancet, place it on your finger, and press the button. Then you're going to squeeze some blood out. Make sure that your glucometer is ready, and then you're going to put it to the blood sample and it will suck it right up. 132. That's it. Pretty easy. I hope you learned something. If you have any questions, feel free to comment below.